The pregnancy with Cody was very normal. There was nothing out of the ordinary. The delivery was fine. He was healthy by all physical standards, no issues there. And of course, at that point, they wouldn't have suspected anything else, anything out of the ordinary. So it's very typical. At about 18 months, we noticed that some of the verbal and maybe cognitive things were a little bit off. As far as his comprehension of things that we were saying, simple things. I don't know if he recognized that mama was my name, or that a cup was, I don't know if he associated the object with the word. Some family members thought, well, maybe he can't hear. Well, we knew he could hear because if his favorite show would come on in one room, he'd bolt, he'd run into the other room. Yet, he didn't seem to be hearing some of the everyday things going on, sort of in another world sometimes, that sort of thing. So that was it. And then between 18 and 24 months, basically the lack of progress. There was virtually no change in his verbal skills or what, in my opinion, in his comprehension, in his receptive skills, like as far as him understanding the things we were saying. And so it was at that point that I started reading and researching. And the more I read about autism, the more I recognized my child in other people's stories.
Putting the diagnosis and the name autism with it didn't have much of an effect on me. I always said the whole time that I just thought he was on Cody time, and I still do, It just means that he has some things that he does a little differently, but we all do, All my other kids did,
And Cody's really fun. I usually play with him a lot. He's very funny, and always when he gets home, he hugs our dog.
What's really surprising, and I've had so many people almost tell me that he wasn't autistic because, well, he's so happy. And I hear that, I've talked to a lot of other parents of kids with autism, and they, that's a common misconception that the autistic child is going to be maybe huddled in the corner or something. They are a little bit different socially, and you can't really label an autistic kid because they're so very different. But many of them are actually happy, well-rounded kids. It's just they see things a little bit differently. He does things a little bit differently. It's a different that we like, but he's been joy from the moment he was born. He's a little sunshine. So.
What's that big thing? Is that Olivia? What's that? Piggy? Oh, I know what he's saying. He's saying please.
With Cody's autism, he can't really talk yet or anything. If he wants to tell us something, he usually pinches us and all, but I know it's like he has to do that because it's like the only way he can communicate with us.
So the primary issue is communication. Him understanding what we're saying and him being able to express what he needs. Up until a few weeks ago, he would basically pull us everywhere, grab a hand and pull us. He wasn't even pointing probably 4 or 5 months ago. Now he will point and indicate something that he wants. So he's making great strides. But so that's our primary issue. That's our number one focus as far as his autism goes.
Doggy. What's that dog say, Cody? G.
D. O. Yay, Cody. TARC is wonderful. TARC. Here's one way he's talking. Right now he's just kind of making noise. But TARC has helped us tremendously. He was just a few weeks ago, we barely had any words. And he's decided about 4 weeks ago that he can speak, so that's awesome. Basically, from the minute that we got with TARC, they were here. And the thing about TARC is they're not just providing a service. Some agencies do that. They're really emotionally invested in him and all of the children that they serve. They've almost done things before I've anticipated or had to ask for them. Just in moral support, providing me with training materials, providing us with therapy, everything. I mean, I think they're wonderful.
and they educate us as to how to help his development when they're not here, you know. Give us programs that we can follow to build on what they've been working with in their one-on-one with him. People should help TARC because TARC works. They get results, you know, they care about the children, they care about the parents, they care about the whole family.
Why should people help TARC? People are sort of under a false impression that, and I guess if you don't have a family member who has a disability of any type, maybe you're just not familiar with it, but a lot of people are under the impression that that's just sort of something that maybe the government takes care of, or that just insurance just takes care of. Well, it doesn't happen. Oftentimes, people that provide those kind of services, they can't stay afloat. They depend on the public to help fund them. I mean, as I said, they're emotionally invested in the children that they serve. They're dedicated, and they're doing a service that it's not at your fingertips. You can't just go out and get these services. It's not that easy. The system is not set up that way. And so when you have an organization like TARC, that's their goal. That's it. That's what they're there for. It's just fantastic. I mean, it's hard to come by.